So good afternoon. We are going to see the human body and the structure and functions. So first we are going to what are the human body system. We have inflammatory, muscular and digestive and cardiovascular, respiratory system, the nervous system. If you are there asking any functions and structure means you can like this you can list down in the endometrium we can see the for the skin and nail hair growth and all we can check. So in the endometrium what is the purpose they're using? It's a protect the body against to the outside world. Then we have the muscular skeletal system. The muscular system it will be 206 bones will be created to the framework to strong and light. So we have that hard work tissues and shape of the body and all the muscular system skeletal system will be providing. Then we are going for a digestive system. So digestive system is what it will be excrete system using for the to observe and excretion to we can use it this one. So if you have any wastage also it will be segregated to our body. So it will be joined with your mouth and pharynxes and you can go for that stomach, small intestine and a large intestine and we can go for the anus. Okay, then we have go for the cardiovascular system. The cardiovascular system is the main important work is the circulatory system. It will be carry for the O2 and the CO2 to the body. So it will be provide your in a blood artery and all it will be carry your blood vessels also into the circulatory system. Then respiratory system. So respiratory system mainly we can survey for the oxygen only. So we can use for the airway to the O2 to CO2. They can do the inhale and exhale. The nervous system. So nervous system it's a body communication and control the work. So the brain sends some any messages and it will be received to the spinal cord to million of microconnecting nervous cells to the every part. Then endocrine system. So endocrine is a high speed signal channel in nervous system. So we have hormone will be sent particular messages to the body. It will be connect your tissues and the endocrine system and blood everything. Then we go for the urinary system. So urinary system we have that nutrition around any nutrition excreted and collection and all it will be had to the kidneys only. So it will be filtered to the in wastages also in the kidney. Then reproductive system. Reproductive means it will be part of our new life. So it will be male and females have to need the make a baby. It's a reproductive system. It will be help you out. Then ingometry system. So ingometry system what will do? We have that ingometry means we have sweat spores and gland, oil gland, hair, and every the active follicle and all is there. So in the sweat gland, it will make the your sweat. Then the glands and the pores will be that it will be outcome. So all this we can give this one. Then oil gland and all, your skin will get soft and everything will go milk and protection that. So it will be help to controlling the body temperature. Then we have the rays of suns. Then we can have the scalp and extra cover layer and all the hair will be doing. Then muscular system. So muscular system we have that skull and vertebrae and ribcage and limbs and all have yeah. The skull is main the covering to the brain. So we have that interlocked tightly. We have to fix and immovable to the brain. So we have that connected with the whole the head part. It will be skull. Okay, in vertebra will cover for the head to 33 small irregular bones and so each count we have that vertebra we have fixing. So it will be connect to your spinal cord. Then ribcage. So ribcage is it's made for the pairs of flat and irregular and curved shape. So we have the breastbone and all. It will be protect your lungs, heart and everything. It will be secure in ribcage. Then limbs. So limbs maybe have that arm limbs. So we have that each limbs are 30 bones. So the bones have that 120. So we have that one. Okay, then joints. We have that three bones. It's called a joint. Then we have that ball and jockey joint, shoulder joint, hip joint. So we can write all the joints if you know and all. You can write to the muscular system. So this is another just review part only. You can read it. Okay. Then digestive system. So digestion mainly what are the stages we have there. So in the digestive system mainly we can use for the stool the small chunks. It will be stomach. It will be go for the liquid. So then you can go for the small intestine. It will be work to the your body part. Then go for the parts of digestion. We have the teeth, mouth, and salivary glands and tongue. Then epiglottis, pharynx, then esophagus, liver and gallbladder and small intestine, large intestine and appendix, stomach, pancreas and rectum and anus. So just you can know about the digestive system. This is all the part into the your body. Then heart is main in the circulatory function, we can do it. So it will be carried to your O2 to CO2. Mainly we have that water or carbon dioxide, anything it will be transferred only, we are using that heart. So that vessels maybe have your transport to the all the blood to the one part to another part. Okay, then we are go for the nervous system. So in the nervous system, we have that big brain, cerebellum, a small brain in cerebella, then spinal cord, medulla, and all we have. So in the brain, we have the largest part of the cerebrum. It's called for big brain. So we have that any control method and all, the brain will be cerebrum will be controlled. Then cerebellum means it's a small brain, we can use the for muscle controlling, so that is and all it will be using. Then medulla we have that controlling of the spinal cord and control of the involuntary function and all, it will be control here the medulla. Then endocrine system. So endocrine system is the hormone factory. Mainly we have that estrogen, progesterone, so all the thyroid hormone, so everything it will be controlled to the endocrine system only. So mainly we have thyroid gland, we have that. So mainly we have thyroxine and all, it will produce to the thyroid gland. In the endocrine system, we have the thyroid gland, thymus and parathyroid gland, pancreas, adrenal gland, so then ovaries, testes and all reproductive organs also, it will be come for the endocrine system only. And then urinary system. So urinary means mainly we are using the excretory system, it will be kidney and bladder and urethra, it will be connect to that one part to another part. So mainly we have that any fluid excretion and all will go do for the urinary system only. Okay, so if you are asking any system you can function, you can write. So what is the function, like this you can write it. Then we go for the next female reproductive system. So in the female reproductive system means we have that ovaries and uterus, cervix and vagina, so endometrium, myometrium. So if your cervix means open the uterus, the ovary is a egg, it will be storage. So everything we can write. Okay, then male reproductive system means penis, urethra, testis and vas deferens and seminal scrotum and all, it will be there. Okay, so penis maybe sperm will be woman's vagina, it will be inward. Then we can go for that urethra means urethra, it will be urine posite and all we can using. Testis means it sperm, male sex it will be called testicles. So we can know, so we go for this reproductive system. Then we can go for the sense. So that eye vision. So eye vision we have that cover for the pupil, then cornea, lens, optic nerve, retina and all we can protect with our this one in sense area. Then hearing means hearing we have that external and middle and internal ear will be there. So if you have any sharp object anything means we can hear easily to the ear systems. Then next we can go for the preparation of the facilities of environment modification. So mainly in the hospital structure, what are the modification we need? First we are going for the patient admission. So what is the main step of first we can have timely treatment of the patient once admission. When you avoid the some necessary starting treatment to the patient, then we have satisfied to the patient, then keep the safe environment to the patient. So we can provide all those. Then what are the includes will be there, because it's a different type of condition. Then we have locker, cupboard, patient medication, so all the facilities that they can check, because in the monitoring equipment, charts, sample tubes, so everything one setup means on room means it will be there all thing in the in the bedside, right? So they can everything they can check in while admissions. The patient call system, refrigerator, then we have that any air condition, television, telephone, everything they can check. Then we can go for that what are the supplies we have. Then we have that oxygen, glucometer, ventilation, infusion pump, then spinal cord, so amp bag. This is in a normal clinic we have that. We can have that this accessories and all. Then we can go for that treatment table. The treatment room table means mainly we have some procedure the patient, it should be disinfected to the patient area. Then instruments also we can keep for sterilization, because of if you are, we should avoid the infection and all. Then sterile supplies and all we can have that, say the needles and blades and dressing and all we can use the sterile items only. Then biomedical waste, because we should avoid the nosocomial infection, so we are following some particular color code of the biomedical wastage. Then articles means PP means we have gown, gloves, mask and all we can use it. So that is and all it's a main. Then preparation of the bed. So depend preparation of the bed means according to the condition. So if you have patient are breathing difficult, follow position we can keep. So what is the main preparation of the bed it's needed? So mainly we have patient comfortable, patient gets relaxed, skin irritation to avoid. If you have solid means keep solid linen means we should change. Then we can have ward neat appearance also, it's a main thing. Then only they can't get any infection to the hospital side. So we have that specific bed, we have simple bed, special bed and closed, open, occupied. So in the normal condition we have this type of bed. So in the post operative bed means the patient get after surgery, that is called as post operative bed. Then we go for the cardiac bed means this is heart any bed related. Then orthopedic means we can orthopedic patient, we can burns means burns related patient we can keep. If your patient has vacant means we can use for the closed bed. So once prepare the unoccupied means we should all the keep the blanket and the top to bottom everything, it will be neat and tucked to the side, we can keep. So the pillow should not be placed, then only it will be occupied or non-occupied we can check. Then keep the blood bad plugs in bedside and all. Then we have IV stand, kidney tray, that is and all we can keep there in O2 section. Then we have that bedside locker check. So everything we can keep. Some toilet articles also we should keep. Then patient if you have want to read newspaper also we can keep. So if patient relatives anyone wants to stick also we can put chair. So everything we should keep that closed bed. Then occupied means if a patient with clients anyone there occupied means that is occupied bed. Post operative means we can keeping for the anesthesia patient with the post operative surgery we can with the hard work we can keep. Then orthopedic, if you have patient have fracture means we can prefer that orthopedic bed. Then we can go for the care of drainages. So mainly what are the drainages we can have? Check the number of tubes in the patient side. So how many drainage they have, so how many incision of them, so anything leaking anything we should check. Then we can have that wound site any sterile dressing needed also we should get. Then we have should always cover the we check the drainage always to level of position we are keeping urine bag around, we can check. Then if you have any discharge for urine or bag means what the color, when then what the what the color, what the amount under we should check. Okay, then we can go for the assessment. What are the assessment we can check? So mainly any leakages, any wounds, any ooze or anything means immediately we should report. Then we can keep always suture site in the tape and document. Then assess the patency of drain. So ensure located to incision of the freedom of king's knots and anything we can put. Then we have the monitor. Then monitor the patient will get any sepsis or anything also we can check it. Then we have any redness or oozes and drain site means immediately we can check patient have get any infection or otherwise we can take the culture swab set test and we can send it. Then we have that any beginning we are shifting to the patient also we should always keep with the suction bag, otherwise anything carefully we should check and shift to the patient if you have, because sometimes they can get infection chances to infection, then get pain and infection it will be get quickly. Then we have that then we can go for the care of IV lines means we have that IV lines is the most common intravenous method using for the hospitalization, because we have administration of medication fluids and a necessity we can put the lines. So in the assessment lines if you are going once that site will be changed, any redness or swelling and we should check, any tenderness and we should take. Then go for the transfer of the patient. So mainly the transfer of the patient we have going for that one patient to another another patient another ward, we can shift, or any ICU, any particular procedure means we should inform to the senior person. Then we are going to shift to the patient. Before shifting patient vitals and we should check, and we can take them to transfer to the patient. Then we go for that, and then we can go for the any foot fare or amputation also, we can provide to the patient. We have that always we can keep for the 5 to 45-degree angle of the patient position. So in the 45-degree compulsory we can give. Then only any breathing or any suffocation also we can prevent. Okay, then we have always one standing, we can check the vitals and BP everything. Then we can tell them to move to the patients. Okay, as the patient, if you have any can able to weight lift or anything means we should avoid that all those things. If your patient have giddiness anything means we can immediately shift to the wheelchair and tell them to walk and come. Okay, then we have next we are going for the terminal cleaning of the patient room. So if you are going for the enter the patient room, we should always check the floors and mattress and bed, food drop. So everything it's disinfected and all. Not we should check. Then TV remote, and then nurses calling devices control. Then we have tablet. Then we can have the bedside table. So cradle, so arms, everything, light switches and everything. We should always do touch and keep for sterile to the rooms. Then we can go for that bathroom. It will at high surfaces to clean toilet and the sink. Then go for every floor and all we should clean always. The privacy of curtain is should be removed, because if here any emergency they can call means they can't able to call. So that's why the privacy curtain and all we should avoid it. Then cleaning the window curtain all means if you're necessary time and all, if you're visible solid means we should clean immediately. Then we have laundry pillow covers, washable pillows, and we can remove and clean. We can keep particular methods. Then we can go for the equipment and recommendation. So oral thermometer, we can after use we can directly put the swab saturation 90% isopropyl we can use. Sphygmometer meter, it's a weekly once we can check that 70% of alcohol, we can use it and clean it. Then bed frames and all means we can hypochlorous we can use it. Then bowls and all means if we can clean it and dry it. Then cloth brush equipments and all we can always clean with the waters. Then we can go for that any disposables or anything means we can dispose it, remaining we can keep wash and dry it. Then lockers, so if you are necessary we can put the patient discharge file in the lockers. Then mattress, so all should be covered within the plastic cover, so it will be have any detergent anything means we should contaminate it. We can shift, we can keep for sunlight for 24 hours. Then cleaning trolleys and all we can detergent, we can water, we can use it and clean it. Then cardiac monitor means we can clean with the isopropyl alcohol. So like this we can use it and clean to the all the area. Then we can go for the slipping and tripling falling. So mainly that housekeeping should be clean and spill immediately. Make if you are marking the spill and wetty area, immediately we can clean it. Then mopping and all we should do. Then only it will be prevent that infection. So removing any obstacle for walkaways and all means free surfaces we can clear it. Always closing file a cabinet and all we should keep. Then keep working areas and walkaways well lit, and footfall and encourage with the safety bar in shows. So we have to always cops and pops and all means we can keep that shower to the near to the washroom area, because if you have patient get any burns or something means we can any spillage anything happen also we can wash it. Then safety bed, the patient safety bed mainly we can keep that once around the base, we can keep for that side rise we can put it, home board footboard and all we can use it. Okay, so mainly we have that protection of the slip to preventing falls. Then we can have any fire alarm and all we can notice, prevent the noise pollutions. So AV and fixed bed and all means we can keep for the patient privacy and safety. Then we can have wheelchair and trolley and all we can keep always. So no water language is lodging in the bathrooms, because it's a falling will be happen. So adequate number of privacy and all we can put the screen to the according to the patient needs. Then electrical safety, the safety flows each equipment, no wire connection, properly bulbs fixed and all we can put. Fire safety means we can use for the roof material construction. Then we have fire exit all building, then smoke detector and sprinkle stations. Then we can give for the hydrogen building therapy and training to the fire management to the stops. Then biomedical waste management. So proper segregation, then proper code should be used whenever your transpiration. We can keep for that infections and all. Then sterile procedure we can do it for autoclave or shaders or needle discharge method and all we can use it. Then we can formation of the hospitals infection control committee, any investigation and all we can do it. Okay. So this section any have doubt means you can ask to me. I will clarify with. Okay. So mainly we can go through here. What are the things we can go through? It means just what are system, what is the function we can know about. Then admission, what are the admission process? Then that is we can do it. Then we can know what are the instruments, what are the solution we are using at all. Just remember it. Okay.